Muslim communities. Additionally, we have Osama El-Gabalawy, who is a fifth-year medical student at Stanford University School of Medicine. We also have with us Aneeqa Abid, who is an undergraduate student at Stanford University. And finally, we have with us Dr. Shady Shebak, who's a psychiatrist who completed his residency training at Virginia Tech and Michigan State University. He's been active in creating awareness about mental health services through the movement for Outreach Volunteerism Education charity. And he's also got a psychiatric practice in Dearborn, Michigan. Welcome, everyone.
With that, I would like to welcome everyone who has just joined us. Assalamu alaikum. Welcome to the Suicide Intervention Panel. And screen time is now for you, Belal. Go ahead, and we're looking forward to hearing what you got to say.
Jazakallah khair. Let me just start by sharing my screen here. Just maybe someone give me a shout if they're able to see it.
Yep, it's good.
Okay. So first of all, thank you for that kind introduction. My name is, as was mentioned, is Belal Zia. I'm a graduate student at the University of Manitoba, and I'll be presenting this talk today with Sheikh Hussam Hilal. And this talk is basically based on an article that we've been writing titled The Islamic Ethics of Suicide and Suicide-Related Contemporary Issues. Our co-authors on the paper are Taimur Kausar and Dr. Rani Awad, who unfortunately were not able to join us in presenting today, but inshallah we'll be delivering the talk on their behalf as well. So I'll pass it off to Sheikh Hussam to start us off.
All right, assalamu alaikum everyone. I hope you're doing well. May Allah bless and give you Jannat Firdaus, and thank you, Belal, for passing it on. Before we begin, I just want to contextualize, inshallah, our discussion today by looking at the Prophet Muhammad ﷺ and how he dealt with the issue, how he dealt with the topic at hand. So we know the famous hadith where Nabi ﷺ, has a very strong deterrence against committing suicide. He says, sallallahu alaihi wasallam, that whoever kills himself with anything in this world will be tortured with it in the next world. Now, this sounds harsh, and Bilal will comment on that later, inshallah. But to contextualize it a little bit better, Ibn Abbas was approached by an individual in the community, and this individual said, I want to ask you about murder. How bad is murder? And Ibn Abbas, in the first circumstances, it's terrible. It's one of the biggest sins that one can commit. It's a major sin. It's very difficult to get forgiveness from or after committing that sin. Another instance, the same question came from a different person. And Ibn Abbas had a very different answer. He says, Allah subhanahu wa ta'ala is the most forgiving. Do you have a mother who's alive? Go take care of her. Ask Allah to forgive you. And he basically opened up the door of forgiveness for the second person. And the reason for the difference between the two is the first person was not or did not commit the act yet. The first person actually, the first person did not commit the act yet. He was thinking about it. And that's why the deterrence came from Ibn Abbas, that it's a major sin, don't do it, don't even consider. But the second person had already committed the act and was very remorseful and was very regretful and was looking for redemption and was looking for an opportunity to connect with Allah subhanahu wa ta'ala. And that's why from a jurisprudential point of view, the scholars will tell us that there's a difference in the way that we're going to treat somebody who's coming in with a question, who's coming in with some sort of anxiety or some sort of struggle based on where they're at and based on the life circumstances. And the Nabi Sallallahu Alaihi Wasallam taught us about this beautiful, again, or the way that we should deal with the situation depending on the person, in the way that he dealt with people who actually passed or died of suicide in his lifetime. So once a man came from the companions and said, my son had actually died of suicide. And Nabi Sallallahu Alaihi Wasallam refused to pray the janazah, but at the same time he commanded the companions to pray the janazah. So in doing those two, by refusing, he's making it clear to the companions that this is a very serious, a major sin. And by getting others to do the janazah, he's affirming the belonging of the individual in the community. So he was able to, again, affirm while at the same time deter against the act. And we know at the end of the day that this individual, and Nabi Sallallahu Alaihi Wasallam was asked by the father, what's going to happen to my son? And Nabi Sallallahu Alaihi Wasallam said to him in the hadith, which is authentic, that Allah subhanahu wa ta'ala has forgiven your son. Allah has forgiven your son because the context of the individual, he was under so much pain that he could not tolerate that pain, and Allah subhanahu wa ta'ala took that into account. So that's why the consensus of the scholars tell us that at the end of the day, It's about the specific individual's weight and the specific individual stress, and we can't have a general ruling on suicide. Yes, it is haram, absolutely, to deter, but once the act is done, for whatever reason, we keep the doors of forgiveness and redemption open.
Thanks, Sheikh. So just to get us all on the same page, when we're talking about suicide, we're talking about the intentional taking of one's own life. Now, by conservative estimates, an approximation of 800,000 people will take their lives per year. And to make matters even more stark, for every suicide, there's an estimate, and again, it's a conservative estimate, that there will be 20 attempts or 20 reported attempts. And the reason why that's conservative is, for one, suicides can be underreported. And two, when it comes to attempts, we're only really classifying the attempts that come to the attention for medical attention or come to the hospital and things like that. So we don't necessarily capture the attempts that actually don't make their way into the hospital. So there's reason to believe that there's actually quite a few more than 20 attempts per every suicide. Now, the impact of suicide is sort of more broad than what we tend to think. We tend to think of it as just affecting an individual, but really suicide does affect the individual, and it affects individuals obviously through the loss of life, but also through the complications and bodily harm. So complications like paralysis or organ failure following a non-fatal attempt at taking one's own life. Suicide also affects families and friends through complex and often devastating emotions like grief, bereavement, guilt, and shame. And then also suicide affects communities at large beyond the family. So suicide places an economic burden on healthcare systems. It also places an economic burden on society in terms of productivity. The person who's lost their life will no longer be able to contribute to society at all. And then it also affects the communities in terms of suicide contagion. And we'll talk a little bit more about that in a couple of minutes. But basically, suicides can actually generate a contagious effect where other people will copy someone who has killed themselves. So when it comes to the suicide in the Muslim populations, there's a couple of interesting findings. So the first finding is sort of consistently across the board. Muslim populations tend to report lower suicide rates compared to other religious groups. So that includes both Muslim majority countries and non-Muslim majority countries. But there's a problem with these data in that, one, they may be outdated, and two, in many of these countries, suicide is actually considered illegal and it carries a social and legal stigma. So suicides may actually be underreported in many of these countries or in Muslim populations in general. The second finding, and this is an interesting finding that's just starting to emerge in the literature, and some of my colleagues and myself have done some research in the Muslim American community, but the idea here is that Muslims in some Western countries may actually have higher risk for suicide than other religious groups. And I won't talk too much about why that is, but if people are interested afterwards, I'm happy to touch base on that a little bit. But the main takeaway here is that suicide is not very well studied among Muslims. The literature is actually very sparse when it comes to suicide among Muslim populations, both when it comes to rates of suicide, sort of risk and resiliency factors for suicide, and sort of generally anything to do with suicide among Muslim populations. Which brings me to the impetus for this paper, actually. So the suicide research among Muslim populations is actually proliferating. So at the Stanford Muslim Mental Health and Islamic Psychology Lab, for one, we're doing a lot of research on developing a line just specifically looking at Islam and suicide and Muslims and suicide. But what's needed and what's missing in the literature right now are English language resources exploring Islam's stance on suicide. And the reason why these are important is because they'll facilitate the suicide research among Muslim populations for people who aren't aware of Islam's moral stances on suicide, as well as the treatment of suicide in Muslim populations. So it'll help clinicians understand risk factors and resiliency factors for Muslims while the research is continuing to emerge. So Sheikh, I'll pass this over to you again.
Now, as we mentioned before, Nabi Sallallahu Alaihi Wasallam affirmed the belonging of somebody who committed or somebody who died of suicide. And at the same time, he made it clear that the Quran prohibited suicide. And the Quran is clear in saying, وَلَا تَقَتُلُوا أَنفُسَكُمْ. Do not kill yourselves, for Allah subhanahu wa ta'ala is merciful towards you. So the prohibition is clear, and the commentators say that this command, it applies to individuals taking their own life, and also it applies to individuals or communities taking other lives as well. So it applies to both from a commentary point of view. Now, in terms of why suicide is prohibited in Islam, you will look at the union when you put together all the hadith and the ayat of the Quran. You will come to the realization that there are basically three reasons. Number one, Allah subhanahu wa ta'ala has put honor in the life of the human being. So the human being is considered to be an honorable being, and the life is a gift from Allah subhanahu wa ta'ala. Allah subhanahu wa ta'ala says in Surah Al-Isra, وَلَقَدْ كَرَّمْنَا بَنِي آدَمَ, that we have honored the human being. وَلَقَدْ خَلَقْنَا الْإِنسَانَ فِي أَحْسَنِ تَقْوِيمٍ. We've given the human being, created the human being in the best form. And one of the purposes or the maqasid of the Sharia of Islamic law is to preserve human honor and human dignity. The second reason is the tests or the struggles that often push people or get people to think and consider taking their own life or dying of suicide. It has to do with hardships and difficulties, and the Quran gets us to imagine those hardships and difficulties as blessings, that they can cultivate a sense of serenity, a sense of realization, a sense of refreshment, that they can, even if we don't get the reward fully in the dunya, in this world, there is a reward for patience in the hereafter. إِنَّمَا يُوَفَّى الصَّابِرُونَ أَجْرَهُمْ بِغَيْرِ حِسَابٍ. So justice is always served, whether partially in this dunya, in this world, or fully in the hereafter. The Quran frames suffering as a blessing and a form of elevation, especially if it's out of somebody's command. If they've done all that out of somebody's capacity or control, if they've done all that they can, there's the ultimate trust that one puts in Allah subhanahu wa ta'ala. And also there's the right of the body and community on the individual, that I have a right, or my body has a right upon me, as the Nabi sallallahu alaihi wasallam says, وَلِبَدَنِكَ عَلَيْكَ حَقًّا, that your body has a right upon you, and also your community has a right upon you. Your friend has a right upon you. Your wife has a right upon you. Your husband has a right upon you. Your community as a whole has a right upon you. So it's not just an individual decision that one would be taking, it's a community decision. How is this going to impact my wife? How is it going to impact my husband, my father, my sister, my brother, other people in the community that may be looking up to me, my friends? وَلِصَدِيقِكَ عَلَيْكَ حَقًّا, as the Nabi sallallahu alaihi wasallam says. So when you look at these triad, or when you look at this triad in terms of difficulties being framed as blessing or opportunity to reflect and to become stronger and to build tenacity and resilience, when you look at the right of the body and the community on the individual, and when you look at the value of the human life, you will come to realize that, again, suicide is strongly prohibited in Islam.
So that's just a general overview of the issue of suicide itself. But when it comes to suicide, there are also certain topics that involve suicide, but they're also conceptually slightly different. So we'll briefly highlight three topics and the main points associated with them. And again, it's going to be a very brief overview, and there's more detail that, inshallah, that will come in our future paper. So the first topic is medical assistance in dying, MAID. Sometimes it's called physician assistance in dying, or PAD. And we'll use the terms interchangeably for the most part here. MAID is the practice by which a physician actually either provides or administers life-ending drugs to a patient. Now, this is also sort of more complicated because patients have to qualify for MAID. Typically, they have to be diagnosed with a terminal illness. They have to demonstrate that they're in unbearable physical and or psychological suffering, that they're not being coerced to take their own lives or asked for medical assistance in dying. And then the other important piece here is that the legality and the definition of MAID actually varies from country to country. So, for example, in Canada, there are laws that allow MAID sort of across the board. In the States, there are certain laws that prohibit it in certain states. And then when you go to countries in the Middle East, for example, it seems to be completely restricted across the board as well. So we'll talk a little bit now about the ethics associated with this that are maybe more specific than just the suicide ethics.
Now, of course, we want you to read the paper, so we're just glossing over the general overview, and inshallah, you'll get more information in the paper and the papers to come, bi'idhnillah ta'ala, by the will of Allah. But the consensus is that pad among Islamic medical associations, whether in North America or the United States, the consensus is that if any form of assisted death, whether physician or otherwise, would basically be considered unacceptable, impermissible. And the reason for that is because we believe that the dominion belongs to Allah subhanahu wa ta'ala and Allah subhanahu wa ta'ala alone, that Allah subhanahu wa ta'ala is the one who ultimately makes that decision of when somebody basically leaves this world. Allah subhanahu wa ta'ala tells us in the Quran that Allah is the one who gives life and Allah subhanahu wa ta'ala is the one who causes death. Just causes recognized for killing are in the context of war and in capital punishment as outlined in the Sharia. And even then, there are rules for engagement that we're going to come to later, inshallah. And as we mentioned also, suffering is considered to be a part of life, and Muslims are meant to approach it with patience and a lens of positivity, that this is an opportunity to build, again, tenacity and resilience.
So the second point, or the second topic that's related to suicide is the idea of suicide contagion. And very briefly, to help contextualize this, basically suicide contagion is this phenomenon where after a report of a suicide, and that could be within the community, but it's especially gotten a lot of track record. There's a track record of being recorded after the death of a notable figure. So for example, like a celebrity after they've passed away, we can see that there's a spike in suicide rates. And those spikes can be geographical, like in the same vicinity, or they can be sort of temporal at the same time. And typically the understanding here is that at-risk individuals, and especially youth or individuals who have a mental health problem or a mental illness, may actually view suicide as a viable option in relation to a person who has already taken their lives. And so they may attempt to copy or to sort of follow in the footsteps of that person by taking their own lives. So when it comes to mitigating contagion, there are a couple of important factors. Typically, suicide contagion management or postvention will include supporting family and friends and community members in emotionally processing the death of a loved one or a person in their community. And then there's also this idea that media, the community and the media especially, should follow responsible reporting guidelines. And that would include things like, not disclosing the means of death, not over dramatizing or romanticizing the death of a person who has killed themselves. And by doing that, you can hopefully contain this contagion and not allow it to spread to other people in the community.
Excellent. And when looking at the ethical considerations for contagion, when looking at suicide, it's important to remember that the Quran is very explicit about not dramatizing news when it comes out. So Allah subhanahu wa ta'ala tells us in the Quran, أَذَاعُوا بِهِ وَلَوْ رَدُّوهُ إِلَى اللَّهِ وَإِلَى الرَّسُولِ عَلِمَهُ الَّذِينَ يَسْتَنبِطُونَهُ minhum, which basically means that when news comes to you that could have huge impact on the community's well-being, rather than disclosing, what you should do is go to those who are experts and who are going to be able to manage the news and share in a way that also manages the emotions of the community. So to reiterate Bilal's point about the importance of having, again, fair reporting, but also ethical reporting as well. And in terms of the considerations for suicide contagion specifically, we have to remember that we have a duty towards one another, a duty of a responsibility of nurturing. And Nabi Sallallahu Alaihi Wasallam taught us that we're all caretakers and caregivers, and that we have to live up to that expectation, to that responsibility, because others are going to depend on us and others are going to need us. So sometimes when we fail our part in nurturing, we can contribute to somebody's suffering. We can contribute to somebody's misery, whether directly or indirectly. And so we need to, as a collective, think about the consequences of our words. And Nabi Sallallahu Alaihi Wasallam says, perhaps a word that you say and you don't intend can actually take you to the lowest position in a terrible punishment in Jahannam. And so we have to be careful about the responsibility in terms of nurturing. Secondly, we have to also be critical of what happens around us. Just because someone has died of suicide and that person is famous and that person is celebrated doesn't mean that suicide is a legitimate option. And Nabi Sallallahu Alaihi Wasallam teaches us in the hadith, لا تكن معه, don't be a follower. إن أحسن الناس أحسنت وإن أساءوا أسأت. Don't just be a blind follower. When people do good, you do good. And when people fail to do good, you also go along and fail to do good as well. Rather be a critical thinker. When people do good, you're a reason for that goodness. And when people fall short, you offer solutions. So again, Islam teaches criticality. Don't just copy, don't just go with the flow. Think for yourself and look at the best option that works for you, and be critical of what's happening around you. And finally, we're also supposed to, as Muslims, think about the cascade of our actions. And Nabi sallallahu alaihi wasallam, he teaches us, "Man sanna sunnatan hasana, falahu ajraha wa ajr man tabi'aha ila yawm al-qiyamah." Whoever has has left a legacy of a good deed, that person will get the good deed and the reward, or the reward of the good deed, and the reward of anybody else that does that good deed. And the opposite is true. Whoever leaves a legacy behind, inspires others to do not the best of things, will carry also a burden of that sin as well. So when you look at those things, again, those are important considerations from Islamic ethics point of view to think about when looking at suicide contagion.
Thanks, Sheikh. And so the last point that we talk about that's related to suicide is suicide killings. This is a very complex and very controversial topic, and we'll discuss it more in depth to some extent in the article. But really, the reason for including this in this presentation and including it in our paper is this idea that when we searched for suicide in Muslims, suicide in Islam in databases, the results we got were mainly focused on suicide killing and martyrdom. So there's actually very, very, very little research on the clinical implications, how to treat Muslims who are at risk for suicide, the suicide rates for Muslims, any sort of demographic information, the risk and resiliency factors. So the idea that we sort of thought of is that if there is a clinician or a researcher who is working with Muslims and they're not familiar with the Muslim population or the Muslim way of life or the Muslim ethics, if they go to do some research independently and search up suicide in Muslim or suicide in Islam, what they're going to be presented with is tons and tons of research about Islamic suicide killing or jihad or martyrdom or things of that nature. And so what might happen is they may wrongfully see their patient as a risk to others rather than a risk to themselves. And so part of including this topic in our paper was to help demystify this idea of suicide killings and really bring back the focus that a Muslim who is at risk for suicide will likely still just be at risk for hurting themselves and not for hurting other people.
Thank you, Belal. Now, there is a lot to discuss here, and we wanted to discuss it a little bit more in the paper in terms of the recent fatwa that have explicitly talked about the case of Palestine and have mentioned that in the case of Palestine, some contemporary scholars consider that to basically be an exception, and they say that because it's an unjustified occupation of the land, and because everybody serves as a militant part of the Israeli Defense League, that they have discussed again the potential for suicide bombings being acceptable there. However, that is a very small minority of the Muslim community. It's important to discuss it because it's there and it's going to be cited in media and others. But generally speaking, if you look at Abdurrahman al-Jarbu', and he's a representative of the Saudi Arabian Fatwa Council, he mentions suicide bombings, regardless of the intent behind them or the socio-political context that motivates them, are unjustifiable, Islamically forbidden acts that lead to eternal condemnation. So notice here the clause, and there's a big paper that he produces on this topic, and Al-Azhar does the same thing, and the university in Malaysia has produced similar work. The focus here is on the socio-political context. It doesn't matter what the socio-political context is, it's absolutely unjustifiable in any way, shape, or form. And of course, it's important to cite the prophetic rules of engagement, that when you are engaging, you're not to touch women, you're not to touch children, you're not to touch houses of worship, you're not to touch or cut down trees or resources that are going to be used by the community, including wells and things like that, or at least permanently damage them. You might limit access for temporary time, but you cannot permanently damage these things. And of course, there is discussion on some classical fatwa. So for example, at the time of Al-Ghazali and before him, there was a discussion on whether Muslims can basically, when the Crusaders would use Muslims as human shields, are Muslims then allowed, in the name of basically defending against the Crusaders, are they allowed to eliminate other Muslims or other innocent people in order to basically get to the Crusaders? This was a big discussion in Islamic fiqh. And of course, Al-Ghazali's response was it's absolutely unjustified in any way, shape, or form, regardless of the seeming benefit that comes with it. So again, this is a bit of a, I guess, a bit of a detailed discussion from a fiqh point of view, but we wanted to basically give you a holistic image so you have the data in mind and be aware of where everybody's situated, and also look at the relativity in terms of the weight that each fatwa was given. The consensus now and back then, if you look at Al-Ghazali in terms of his response back then, and if you look at the bodies of Muslim fuqaha in the contemporary time, would say that it's unjustifiable regardless of any socio-political context.
Okay, fantastic. So that brings us to the end of our presentation. We'd like to thank all of the members of our Stanford Muslim Mental Health Lab who've looked at earlier versions of this presentation, as well as earlier versions of the manuscript, and as well as some of the commentators that provided us feedback on the ethical issues that we brought up and helped guide us in this research. So inshallah, thank you to all of them, and we'll be happy to take some questions at this point or later on.
Thank you so much for the presentation. We will be having all the question and answers in the end. And also, I can't wait to read your paper. Sounds very interesting. We're ready for our next presenters. Suicide response in the American Muslim community, case study and cultural formulation. The screen is yours.
Thank you so much, Jazakallah khair. And thank you to Belal and Hussam for sharing that amazing presentation. Is it looking good for everybody? Okay. So assalamu alaikum everybody once again. The presentation we will be moving on to now is titled Suicide Response in an American Muslim Community, Cultural Formulation Utilizing 2 Community Case Studies. I'll be presenting this alongside my colleagues Osama El-Gabalawy and Aneeqa Abid. And so just to get into the introduction, I'll pass it off to Brother Osama for the first few slides.
Assalamu alaikum everyone. So like Kamal mentioned, we're part of the suicide research line in Dr. Ranya's lab, along with Belal and Sheikh Hussam. They've been helping us and been an active part of the research we've been doing. So just to intro, Belal kind of touched upon some of these stats, but nearly 1 million, about 800,000 people die by suicide worldwide, which represents 2% of the total global burden of disease. In the US specifically, rates have steadily been rising over the past 2 decades, and these are age-adjusted rates. And it's an epidemic that is continually impacting America. Suicide rates in Muslim majority countries and Muslim populations in the West are low and often differ due to underreporting and stigmas, legal ramifications as well. But the general consensus in the literature is that Islam is a protective factor against suicide. However, and this is a very important however, American Muslims and Muslims in the West may be at increased risk of suicide. And there's a number of reasons that may be. One is that racial and ethnic discrimination in America is rampant. 48% of Muslims, according to Pew, report at least 1 incident of suicide. The FBI metrics, anti-Muslim assaults have surpassed 2001 peaks. And the psychological distress, threatened sense of belonging, perceived burdenness, social isolation are all kind of factors that play into this. And this is something that we are actively researching and trying to better understand in the lab. Draconian policies, the Muslim ban and its repercussions have been implicated in suicide of refugees and asylum seekers. Dr. Rania published a case study basically on a story like that. And then, just kind of culturally, many Muslims view mental illness as a test from God, often seeking counseling from religious leaders. And so a big part of the research project that we're doing here kind of lends to the fact that, religious leaders are often the first line of defense in the Muslim community. And so, and many of them do not feel prepared to handle mental health crises and suicidal crises. And so a big part of, offering services to the Muslim community is working hand in hand with Muslim religious leaders and mental health professionals to create the most impactful safety net for the community at large. And despite these concerns, suicide is still a poorly understood topic in the Muslim community, and it's part of the reason why we're working so hard on it. So the context for this specific project, So the Muslim Mental Health Lab at Stanford was founded in 2015. And in Palo Alto, the neighboring school district, they were experiencing in 2015 their third suicide cluster in a matter of 10 years. And suicide clusters kind of come from this phenomenon that Belal touched on called suicide contagion, which is the direct or indirect transmission of suicidal behaviors just by proximity. And this could be even something as like even Netflix, I forgot what the name of the movie, but like this can happen on a national level too, when there is media or, exposure to suicidal behaviors or ideation that can decrease the threshold for which people may act on their own thoughts of self-harm. Exactly 13 reasons why. So postvention is this idea that in the aftermath of a suicide, you want to create programming and safety nets and a really, intentional response to suicide. And it's more than just a compassionate response. There's garnering evidence that this is really critical to prevention of further suicides. So after the suicide clusters in Palo Alto, a team of professors at Stanford and working with the school district put together this Herd Alliance toolkit for school administrators. And this was kind of a starting point that inspired our lab to create a manual and a toolkit for suicide in the Muslim community. And this was accelerated by the fact in 2017, in the East Bay area, there was a suicide of a high school student that really impacted the community. The fire alarm in the house went off, I'm sorry. But after that, in 2018, there was suicides at Masjid al-Haram that really sparked an international debate about the criminalization of suicidality in the Muslim world, the lack of resources. Okay, I'm gonna mute myself, but I'm sorry, it's but in the suicides at Masjid al-Haram sparked an international debate. And then obviously since 2018, our lab has been contacted multiple times in the unfortunate aftermath of suicides in American Muslim communities. And these are, obviously this case study that we're gonna present is based on 2 suicides that happened in the same community. And a big part of the framing of our study. Sorry, one more slide. Okay. So our study, we investigated 2 neighboring Muslim American communities in the response to incidents of suicide. For the purposes of maintaining anonymity, if you, maybe some people in the community, because it's a small community, might know where this place is, but we are trying to maintain confidentiality as much as possible of the families involved. So we will not discuss kind of when exactly these took place and which communities took place in. But we kind of did a number of interviews because this was a little bit unusual for 2 suicides that happened in the same community. And we tried to explore cultural and religious factors. And we basically, for both communities, we gave them our preliminary work on suicide response. And we wanted to assess how it worked for them and what could improve. And we wanted to take that feedback and to improve our own suicide manual and our suicide training program and our thoughts and discussions around that. And finally, we proposed the necessity of disseminating a widespread Muslim community suicide response manual, as well as trying to create a suicide training program, which we'll delve in a little bit at the end. For that, I'll give it to Kamal.
That's me. So the methods we used in our study were semi-structured interviews on which we conducted an informal thematic analysis. So we conducted 3 interviews for both communities, one with mosque leadership, one with actively involved supporting community members, and one with the bereaved family members. These communities served as case studies that we studied using the cultural formulation lens, and our analysis revealed cultural and religious factors that caused stress, impacted decision-making, and revealed gaps in the community response. The 5 themes we observed were spiritual implications of the deceased, community connectedness, privacy, shame and the implications of shame, and knowledge and communication barriers. And we'll be going into more detail for each of these themes shortly. But first we'll do a brief introduction to each community with mostly identifying details removed due to ensuring the protection of privacy concerns expressed by both communities. So our first community was a suburban upper middle class community that was ethnically diverse. The victim was a young man who was survived by his parents and younger siblings. The imam and his parents described him as an active member of the community, well known by other community members. And the response actors, those who responded and supported the family after the incident, included the mosque's imam and a local mental health advocate. Immediately after the incident, the community contacted the Stanford Muslim Mental Health and Islamic Psychology Lab, and they received a consultation with 2 lab affiliates with professional clinical and Islamic training. Over 75 local attendees joined this conference call, and there were mainly 3 important concerns that were addressed during this call. The first was ensuring that grieving family members were treated respectfully. And the second was clarifying spiritual and metaphysical connotations of suicide for the family and the wider community. And the last was organizing a public mental health awareness event to discuss suicide and mental illness. The community responded by organizing a meal train for the bereaved family members, which helped remove a burden from the family's responsibilities and offered social and community support to the parents. Additionally, the mosque leadership organized khutbahs on mental illness and suicide and organized a large public mental health awareness program that was very well attended by community members. Our second community was an urban, lower middle class and ethnically homogenous community. The victim in this community similarly was a young man survived by parents and younger siblings. He was described as well known to the community as well, and also described as coming from a very well educated family. The response actors in this community were the executive board of the community and a Muslim chaplain from a nearby university. The executive board communicated via email with the lab as well and received an early draft of the suicide prevention, intervention, and post-prevention manual, which we will be introducing at the end of this presentation. It's important to note that this community did not have a direct consultation with the lab like the previous community. And possibly for that reason, they did not find opportunities to operationalize the recommendations from the manual. This community also responded by organizing a meal train for the family. The family also received private pastoral counseling from the Muslim chaplain. The response programming and support provided to the family was hindered and limited by COVID-19.
Thank you so much, Aneeqa. So now that we've given summaries of the 2 cases in these communities, we're going to start delving into the themes that we were able to identify, and essentially just moving into the findings that we wanted to discuss in our paper. So the first of them was the spiritual implications for the deceased, in this case, the victims of suicide. And it was important to note that across both of these cases, interviewees reported that the spiritual standing of the victims after losing their lives to suicide was a source of significant worry for both the family and also the larger communities. In specific, the hurtful belief that the act of suicide might be an unforgivable sin. For these families who reported themselves to be religiously grounded families, this was a compounded distress on top of the grief of having lost their son. And it was the primary role of the imam in the first community and the Muslim chaplain in the second community to offer their clarifications and to offer education to the families and also to the wider communities. And they specified that while the act of suicide is a sin, it is not necessarily beyond God's mercy to forgive. And the first community's imam, alongside comforting the family and offering those clarifications, also led them in dua and was able to be a role model for others in the community by supporting them in public, for example, at the janazah, in order to spread the message that this family is in need of support from the community and not judgment. And the second community's Muslim chaplain, in the private counseling sessions that we discussed in the case summary, he was able to answer similar spiritual questions, also lead them in processing activities, and provide resources to them during those counseling sessions. And in general, the families reported that the knowledge of hope in the afterlife for their son opened the door for their healing process, because, like I said, they reported themselves to be very religiously grounded. And for them, in order to use the spiritual coping mechanisms that they were accustomed to, they needed to know that they had hope and the ability to make dua and ask others for duas as well. And in general, find solace in the acceptance of Allah's will and the ability to make dua.
Our second theme is that of community connectedness and the benefits and drawbacks that come with it. So we know from suicide literature that social connectedness is a protective factor against suicide. And in the aftermath of a suicide, it could definitely prevent suicide contagion. We observed that a close community was able to provide timely and consistent socio-emotional support and community-wide organization and mobilization in the form of meal trains and mental health awareness program. However, there were also many drawbacks of a close community as well, including potential breaches of privacy, lack of boundaries, gossip, shaming, and the perpetuation of stigma. And even if these things don't happen, there may be a lot of fear or worry of this happening. The issue of privacy was also an evident concern for both religious leadership and the families of the deceased. The two families, however, varied in how private they were and what boundaries they drew about the incident that happened to their family. So, for example, the first family encountered visitors bringing their own children for them to learn a lesson. Like while the first family was like okay with this and willing to participate this, the second family, on the other hand, particularly reported avoiding interactions with members of their community due to a lack of boundaries, and were afraid of questions about the means of death and other questions. So as we mentioned, the primary concern appeared to be that some community members would be insensitive to families' pains and may insert themselves into the situation to satisfy their own personal curiosity. And in the first community, the mental health awareness programming provided a reconciliation for this. That was, and this was offered by religious leadership. So teachings directed towards the community emphasized that the goal of visiting a family should definitely not be to satisfy one's own curiosity, and the goal should only be, the goal of visiting the bereaved is an obligation founded on principles of offering condolences, prayers, and other forms of emotional and pragmatic support for families.
And really an extension of this issue of fear of privacy breach was the concern for shame and the potential for a propagation of shame culture. The leaders and involved parties from both of these neighboring communities made the decision to not publicly share that suicides had taken place, whether that was at a khutbah or at a janazah, or when community members approached them asking questions about how the individual passed away. They made the decision to only say that there had been an accident. And they also wanted us to be clear that this was not necessarily to hide that a suicide had taken place out of shame, but it was rather to prevent unacquainted families from making judgments without the necessary religious knowledge. And this was such a concern for them that they decided, even though they want to spread knowledge and spread awareness about suicide, that in their interactions with the community, they decided to not specify that suicides had taken place, which we felt really demonstrated the preeminent fear of shame that does exist. And the first imam in particular wanted to specify that although he made this decision, he continued to show visible support for the family at the janazah. And particularly, he was aware that people do talk, is something that he said, that the information would spread throughout the community, and the information might be out there regardless of whether or not he specifies. And so it was his duty to play that role model role. And the second community, the executive board of the masjid mentioned that due to the fact that it was COVID-19 at the time, it was a really serious concern for them, a similar idea that gossip spreads and people talk regardless of what decisions they made. It was a very serious concern for them that they were not able to participate in those conversations and have the community forums that they usually would have to play that role model role. And you also see, for example, what Aneeqa was talking about earlier, that this fear of shame led to divergent reactions from the grieving families. The first family decided that they felt a sense of duty and hoped to champion change and spread awareness, and decided to remain open when people approached them about how their son had passed away. They said that a suicide had taken place, and that was their decision, and they cited a desire to want to champion change. And the second family, however, was averse to the idea of receiving a potential judgment and receiving potential shame. And they decided that when people approached them, including members of their extended family even, they did not specify that suicides had taken place. And some of the important implications of the fear of shame are that those in supporting roles after suicides take place have to go to great length to understand what the individual family's perceptions of shame are, and understand that not every family is going to be prepared to be the champions of change in their community. And so they might want to err on the side of caution, as these leaders decided to do, that they did not want to direct accidental judgment to the family, and so they decided to remain unclear about how the individuals had passed away. However, it is still highly recommended that to respectfully encourage emotional expressiveness and vulnerability in the grieving families, because the first family, in their decision to remain open, specified that led them to be able to engage in authentic conversations with people and develop deeper relationships with their neighbors and their friends and their community leaders. And they said this really aided them in their healing process. And the second family reported much less comfort with expressiveness than the first, and that ultimately, when they had private counseling sessions with the Muslim chaplain, it was a very challenging process for them. And they felt like, according to their cultural norms, that they did not want to talk about their emotions, but that ultimately they found it very rewarding. And they hope that there will come a time when this fear of shame culture, as they called it, could become less significant, so that other families would feel comfortable being vulnerable and accessing the support that they need. And lastly, the final theme that we wanted to discuss was knowledge and communication barriers that played a role in these responses. It was consistently specified in these communities that more prevention programming is needed, more intervention outreach is needed, and more response guidance is needed. This is a constant emphasis, and we felt that this really demonstrates the present gap in the Muslim community in knowledge and also resource availability, that as soon as in both of these communities, as soon as suicides had taken place, they immediately knew they had to reach out to professionals all the way. They had to reach out to professionals at a Stanford lab in order to receive help, because they did not feel prepared at the time. And we also felt that this demonstrates a clear need for the development and dissemination, like Brother Osama was saying, and he will specify soon, on the dissemination and development of a culturally sensitive, religiously grounded prevention, intervention, and post-prevention strategy that communities can learn and implement, inshallah, in the future.
Yeah, so this is just a last slide, kind of concluding slide of looking forward. And this is a vision for a Muslim community suicide training program. Initially, we just started, the work in the lab just started with post-vention training, and they were all ad hoc meetings that were done with community leaders. But I think with the number of requests that we were receiving, we were very alarmed and realized that we need to make something a lot more systematic and thorough for Muslim community leaders and religious leaders, imams, because not only are they the first ones to really encounter a lot of these really unfortunate situations with suicide, but they often have a very integral role for the healing of the community, for supporting the families and friends and loved ones bereaved by the death of, lost by suicide. But then just looking forward, we want to move away from just reacting to suicides to intervening and preventing actively and destigmatizing conversations and the whole spectrum. And so what the Muslim Mental Health Lab is doing is we're trying to, in addition to creating a really thorough manual that's about 100 pages on suicide prevention, intervention, and postvention in Muslim communities, we're trying to create a kind of an interactive learning environment with the modules and certification process for Muslim communities and leaders for a suicide training program. And that's what we're working on in the lab. And this case study is not only reaffirming the need, but also kind of crowdsourcing a lot of the knowledge from how these different communities responded to suicide. Things like the meal train are things that we learned from this from these communities and how they responded, and things that we're including in the manual, because the family support cited these things as being extremely helpful and so on. So without further ado, I would love to open up for questions and have a good discussion.
Jazakallah khair for listening to our presentation.
Thank you so much. Such a complex, difficult topic handled with such nuance. And now I would like to invite Dr. Shebak to please synthesize both these incredible presentations on the difficult, complex topic before we move on to question and answers.
Assalamu alaikum. First, I want to say thank you for the two wonderful presentations. You guys are doing very good work. It's always nice to see presentations talking about not just the evidence and the scientific aspect, but also the spiritual, religious aspect of these difficult topics. So I commend you guys for being brave to bring up this topic from both a scientific and a religious perspective. Working in Dearborn, Michigan, where I opened my clinic, we are often faced a lot with families who are grieving the loss of a loved one to either overdoses or suicides. People often make the assumption that Muslims or Arab Americans or Arab Muslim Americans or Muslims from all the different ethnic backgrounds are blind to the fact that we have mental health problems or that we face struggles like suicides, drug abuse and addiction, depression and anxiety. But it's not necessarily always the case. A lot of times there's not a place for people to go and to receive the help that they need. And when you provide that service and you provide it with a culturally appropriate, respectful way, people will seek the help, I think. And that's what I've seen. But the most important thing is to respect the other people, the culture that you're working within. So if a culture is based on certain models such as honor and shame, or dignity and guilt, as in the West is often based on, we have to understand what that actually means. What are the protective factors that exist within that cultural framework and utilize them to the best of our abilities, rather than try to put them under the rug and tell them this is how it's going to be and here's how you need to talk about suicide and here's how everything here's how we're going to structure your life going forward. That's not fair for the person seeking the help. We have to provide them with the empathy and the respect. While we know that suicide is haram in Islam, forbidden, that doesn't mean we don't we don't face it, we don't see it, and we don't deal with it. And in the same time, as providers, I think from what I've learned from this presentation is we should also be asking our patients, not just assuming that they, if they're of a Muslim background, that they are Muslim or that it means much to them. We have to actually ask them, what role does the religion play in your life? Because if it plays a big role and they're not going, they say, A'udhu billah, I will never kill myself. Okay, well then maybe there's a protective factor there that's going to stop them from committing the act. But if they say, you know what, I'm Muslim by name, but I don't really follow the jurisprudence or I don't really follow the fiqh, well then they are at that similar risk as anybody else of committing suicide. So we have to be mindful of that and not just label someone Muslim, therefore there's a protective factor, without actually assessing what does that Islam mean to that person. And we also have to understand that even when there's a protective factor or somebody is going through depression, maybe they won't hurt themselves, that doesn't mean that they're not suffering equally as someone who has committed suicide. So we always have to approach people with the empathy and the respect and the dignity that they deserve in order to make sure that we can alleviate some of their suffering. Not committing or not committing suicide does not exonerate or leave the person without any sense of suffering that they still may be going through. And we have to be there for them. When someone does hurt themselves, kill themselves, commit suicide, the families need to be also respected, from what I've understood from both presentations that were discussed. Meaning, it's not okay for us to go onto social media and say, well, this family's son died from 1, 2, and 3, or this person's daughter died from suicide, and why is the family being quiet, and why are they not discussing this, and why are they not addressing this, and why is this being buried under the rug? That's not fair. The families may be addressing it. I could assure you that many families are addressing it, even within my community, but they're doing it in a different way. They're coming to a provider, a psychiatrist, they're working with their imams on a personal level to see how best they can address these things. It does not need to always be publicized. That there's nobody needs to be thrust into a life of activism if they don't want it. And also no one needs to be thrust into the form of activism that we want them to do. Whatever each individual one of us wants someone to do, they're not beholden to that. They're beholden to their own individual morality, their own individual dignity and honor, and the system that they follow. So we have to be very mindful when we are, when a tragedy strikes a community, that we're not just providing lip service or thrusting a family into something that they're not ready for, that we are actually providing the family with the empathy and the care that they need. And that's our role as providers, as physicians, as psychiatrists, as social workers, as therapists, is to provide, and as community members that are not necessarily in the mental health field, because friends, families, cousins, community leaders are just as important as well in providing that support. What we need to, I think, do going forward, as was discussed, is having a way of teaching people in the community on how to address these things respectfully and with dignity, work with our local scholars, which I do on a local level and many of you guys do as well. Bring the Muslim organizations together that are addressing topics of mental health and mental illness to see what is the most balanced and practical approach, not just what's going to be read the most or what's going to be the best title for something or what's going to have a clickbait or what article is going to be downloaded the most, but also actually practical on the ground regional solutions to these problems, prevention, positive ways of discussing mental health. You know, I was giving a talk at the mosque last week on Friday, and one of the things I had mentioned is we don't want to always go to the mosque and be talking about just depression and anxiety and suicide and this. We also want to be talking about positive things, how we can prevent, how we can have programming, how we can bring and invite people to our centers so that they can have a really a communal relationship with the religion and their faith and their community, because religion is protective on a spiritual level, but also on a social and psychological level. It also brings communities together, brings people together. And if we drift too far from that community setting, we will be facing more and more problems. So we have to look at this from an individual, cultural, social, and spiritual perspective in order to bring all these ideas together and really provide positive solutions. And yes, we do need to talk about the dark things, the depression, things like that in the mosque, but we also need to talk about the beautiful things, the light things, the the opposite of that as well. You know, someone had mentioned here that God honors the human, the life, the human life. And I always look at things in opposites. And where there's honor, there's shame. Where there's dignity, there's guilt. Where there's love, there's hate. Where there's joy, there's sadness. And we have to discuss all of these aspects, not just one and ignore the other and push it down into the recesses of our unconscious minds. We have to bring all these things up and make sure that we're doing it in a balanced way so that we're not straying too much in one way or the other. Again, I really appreciate both presentations. This was one of my, honest to God, this was one of my favorites, favorite sessions in the last several years. I've been active with the Muslim Mental Health Conference. So much kudos to you guys. I hope that we can stay in touch. There's a lot of work, and I'm in Dearborn, one of the largest Muslim concentrations. So I would love to be in touch with you guys. We have a lot of opportunities that we can all work together on, inshallah. Thank you guys, and I think I will give it back to Solchi.
Thank you, Shady. We have a few questions in the chat, but we also have a request for a live question. Our Dr. Al-Talib was here viewing the panel, and he has some insights to share and a live question, I believe, for either one or both the panels.
Well, I didn't want to, you can go ahead and ask other questions first. I had my own question, but I can wait in line.
All right, well, there's a question here, which says, is there a training or resources hub on these topics with practical tips for chaplains, imams to use on the field as they engage with people? Research articles are filled with jargon, and it's hard to extract practical tips and best practice that is applicable in real solutions.
Yeah, I can take a stab at this one. So we're working on the suicide training program, which entails the manual and the modules. But shortly after, we're planning on releasing a workbook that's like a very condensed version of the manual that pretty much operationalizes everything that a imam, chaplain, community leader would do for the prevention, intervention, and postvention. And then hopefully the vision down the line is more content that's accessible for different types of people. So podcasts, videos on YouTube or on Yaqeen's platform, but different ways to engage with the content for people on the go, for people who are dealing with acute crises and the different varieties and settings. So we're definitely working towards that in terms of creating more resources for more types of people, even and then beyond the community leaders, for the average person in the community about thinking about suicide and how to talk to your kids and how to be more conscious about it in general.
Well, I have
I think Dr. Hamada actually beat me to the punch there, but yeah, the FYI has some good resources there for the for suicide intervention. And there's a lot of other resources that are not really specific to Muslim communities out there, which they're still useful. They're things that you can use. Osama mentioned the HERD toolkit earlier. They're still useful to pull from. But inshallah, as Osama said, we're going to work on developing these out for more specific use within the Muslim community as well.
I have a question for both the panels. One, when you were looking to do research on a topic as complex as suicide, I'm sure it stirred up some emotions. In matching up with our theme of restorative healing, how did you guys process it for yourselves when you were dealing with that difficult a topic? And what were some of the tools you used for sort of self-care while processing what sounds like complex trauma?
Yeah, this is such a good question, and I think all of us in the suicide line can answer it to some extent. So inshallah, I'll take a first stab at it. I think partly the things that I found most powerful and also most painful to hear were some of the interviews that came out of the cultural formulation paper. There were, mothers and fathers and other family members talking about the loss of their loved one, and of course that wrenches your heart. I think there was sort of the way that we connected as a team. We have meetings every week, and so alhamdulillah, that was a really helpful way to process it together, to talk about the power behind it, to talk about how meaningful the work is. And at least for me, the meaningfulness of the work was what helps to resolve any of the trauma that you face in terms of hearing these stories. Yeah.
I think it's really challenging. I think even when we first started this project, there have been four separate suicides that in communities, and we're talking to them. Obviously, this one is the one we went in most in depth of the interviews, but every conversation was really heavy. And I think, even in academia, the culture is to always put the metal to the pedal and push. But I think recognizing the moments where you need to take a step back, reflect on not only what you're working, but on your own internal state and how it's affecting you. So I think as many pauses as possible and being very conscious about where you are emotionally when you're dealing with this stuff, because it's not easy and it's not light.
I can also speak a little bit about this. As an undergraduate research assistant, I think in working in this line, I've learned as much in the process of talking to these people as the work that we're finding. I've also had to educate myself so much. And I kind of feel like as a young person, this is just extremely valuable information to know. We're trying to contextualize to Muslim populations in general, but the research that already exists in terms of how to process feelings and how to seek help when you need it and all of those things, I think it's just been extremely valuable for me in my personal life as well, on top of the meaningfulness of the work too. And so I feel like that's something that has been very motivating and has helped me a lot.
Go ahead, Aneeqa.
Okay, I was just gonna say that listening to how the family processed their emotions was really beneficial to me. The family relied so much on Islam and like God and hope and mercy and dua, and like they listed how they, like if they ever had negative thoughts, they would rely on these like 4 principles, like dua, hope and mercy of God and other things that I'm not remembering exactly right now. And so learning about how they coped was really beneficial to me. So even though it was really hard to hear, like I was very like impressed by their, like how they coped and their courageousness. And I think that was very helpful for all of us.
I think this is a great question. And in trying to answer this, as someone who's serving as an imam in the community, knowing that this work is being done, that was the biggest motivation for me. Knowing that just the gap and the void that needs to be filled it's really, really refreshing. So may Allah subhanahu wa ta'ala bless all of you who are doing this work, each and every one of you, and everybody who's supporting through your kind endorsement and your comment. May Allah reward you all. But I think also, if I'm just going to share personally, I think the key to successful giving is to also invest in your relationship with Allah, because a cup that is empty will not be able to pour much. So it's important, especially for those of us who are in mental health service and providing this support. It's important that we genuinely connect with Allah subhanahu wa ta'ala, especially at night in Qiyam, whenever we have the opportunity, because it will give you that extra motivation and it will center you and it will inspire you, as Sister Aneeqa has mentioned.
Shady, did you have, Dr. Shebak, did you want to share your experiences with how it's been working with people and families dealing with suicide?
Oh, definitely. First, like I said, there were several instances of suicide in the community that I work in, and people assume that people weren't getting help, and they are. A lot of those families are actually people that are, getting the active help from me. I would love to find a way that we can work together, collaborate. I didn't know about this lab that in Stanford that you are all in. I think it would be a wonderful opportunity for us to come together and see what we can do, because each Muslim communities tend to be diverse in their nature. There are the Arab Muslim communities, there's the Desi, there's the African American Muslim communities, there's the Sunnis, there's the Shias, there's many different Muslim communities, and each have a unique way of dealing with this thing. Each come from a unique part of the world. Some come from urban areas, some come from the villages of the Middle East, North Africa, and the sub-Indian continent. And each community has its very unique ways of dealing with it. And I think this would be a wonderful opportunity to find ways to work together. And there's also the American Muslim Health Professionals, of which I serve as the vice president. And one of our biggest goals is working on mental health related issues. That's one of our 2 or 3 big goals for the year. So it'd be wonderful to touch base and find a way where we can at least be, if not work on something, at least be in touch with each other so we know what each person is working on. So it could be of a bigger benefit to the Muslim community in the US.
We have another question. It's from Catherine Downs. She says, as a mental health provider in training who is not Muslim and is working with a lot of Muslim clients and planning to continue to do so in my career, I first want to say thank you so much for sharing this incredibly important work and much needed context and knowledge from both presentations. Do you think there's a role for non-Muslim mental health providers around issues of suicide if we can learn as much as we can through and about our clients' perspectives? Or do you think it's more important to increase the number of Muslim mental health providers in their communities, or both?
Yeah, I can take a first stab at answering that. First of all, thank you for your work. I think I can speak for the rest of the panel and say that we really appreciate your work with the Muslim community, which is a community that's often underserved when it comes to mental health. And I think that absolutely non-Muslim mental health providers play a very important role. Often Muslims, at least in my work, I've come across this idea that some Muslims may prefer to avoid Muslim clinicians for many reasons, partly because the Muslim communities in their communities can be really small. And so going to a Muslim clinician, it's almost guaranteed that they will know other people in the community. And so even with sort of the protection of confidentiality, a lot of people still worry about that. So they would actually prefer to go to a non-Muslim clinician to get away from their community a little bit to talk about these issues. And there's also the concern about judgment, right? So a lot of Muslims talk about going to Muslim clinicians and feeling like they've been judged for doing something that is sort of inappropriate or unethical or haram. And for that reason, whether or not they're actually being judged, the perception that they're being judged is very important. And so for that reason, they may prefer to go out to non-Muslim providers as well. So I think absolutely it's important to train our non-Muslim providers. I think the main important piece on that is understanding the Islamic worldview when it comes to suicide and understanding the ethics behind it. And also understanding that just because a person is depressed, but they're saying that the suicide is a protective or religion is a protective factor, it may not necessarily be that way. So Dr. Shady actually mentioned this earlier, that Islam may serve as a protective role, and it, to some extent, I think it does. But for some people, there's some literature out there showing that actually, even if you are religious, religion may actually serve as a risk factor. So a concern, for example, among someone who is at risk for suicide or is contemplating suicide, even if they're religious, is a belief that, you know, I'm going to hell anyways. I might as well take my own life right now and not burden the rest of my family with my existence. So that sort of frame of reference, I think, is also important to keep in mind when working with Muslims. And then, of course, promoting more Muslim mental health care workers will definitely be valuable as well, working with Muslims in the future.
All right, Shuchi, can I ask my question now?
Go for it.
All right, thanks. So I just want to also reiterate, thanks so much for the great work you guys are doing. You guys are doing really excellent, high quality work up in Palo Alto. So, you know, I really appreciate particular the kind of your presentation style when you had the sheikh and the clinician kind of go in tandem. It was a nice flow and whatnot. You know, a lot of times you guys, I'm not a sheikh, and so, you know, but I can, you know, say that I heard a lot of the, you know, the consensus of scholars say this, the consensus of scholars say that. I wonder, you know, I haven't heard that narrative. I always hear suicide's haram, haram, haram. I can imagine using the narrative you guys laid out of about the hadith and the Prophet ﷺ, encouraging people to pray for the person that's suicidal and being compassionate, being a very important community and population level promotional tool to educate people about suicide. My question for you is, do you anticipate there's going to be pushback from, you know, imams or even scholars saying, "Oh, you guys are being too loose with suicide"? I just wonder about that. I only say that not to prevent people from taking that approach of the public health education, but to anticipate how to respond to that.
Beautiful question. If you allow me, Bilal, I'll take it on. So first, thank you for your kind words. It's always a pleasure working with clinicians, and I think we need to, going forward as a community, we really need to have a collaborative mindset, and we need to work with each other and take advantage of everybody's expertise. So I do agree with you that there has been a presentation issue in the Muslim community, and it goes back to what you can say basically in fiqh from a jurisprudential point of view. There's a concept of, if something will cause public harm, it's better not to present it massively. So you can discuss it in religious circles, you can discuss it in training, but it's better not to discuss it massively. And there is some merit to this. You know, Bilal would say that, yes, it's good to have deterrence, but at the same time, when we sit on the Imam councils, the consensus, again, using the word consensus, or most of the Imams sitting on the council would say that it's better to educate the community. We live in an era where knowledge is key, and this can definitely help. And I know in ISNA, Islamic Society of North America, Canada, we've done some khutab lectures and sermons and in conferences. So we've made that narrative very clear to our community, and I know other masajid are doing the same. But it's going to take some time for the rhetoric to change. But at least, alhamdulillah, we're on the sitting in the seat where we're driving that change. And I think together, collectively, through the suicide toolkit and the other toolkits that Osama and his team are working on, and I think there is going to be change to come, inshallah.
So just a follow-up question. So in your experience, I mean, when kind of offering that narrative that we should be compassionate, we should not be judging, families or say that they're going to hell, so forth and so on. Have you had push? I mean, we have a very diverse community. Have you received a lot of pushbacks from certain elements of the community that might be more, traditional or more conservative or more literal in their interpretation?
Actually, believe it or not, most of the imams, most of the religious leaders are quite aware of the text, so they don't have an issue with it. Where we usually face some resistance, I wouldn't say too much, some resistance is in I guess the older population who's a little bit maybe distrusting towards the younger religious leadership. that kind of attitude can sometimes manifest. But I would say that within the leadership itself, with the Imam community, I have not personally faced any resistance.
I think also like the complexity of the issue is not lost on our lab, right? Like whenever we have these team meetings, we spent hours and hours and hours discussing, you know, what's the appropriate venue to display this information, especially when it comes to like the moral restrictions. There is research that shows, you know, the moral restrictions actually is preventative, not just for Islam, but for sort of other religious groups as well, including for people who have severe mental health problems like schizophrenia and bipolar disorder. Like the moral obligations can prevent people from taking their own lives. So we've had this like really complex discussion again and again, and I think it's still an open conversation that we'll continue to have about the extent to which we want to emphasize the compassion piece, the extent to which we want to emphasize the piece of the sort of the moral restrictions. And I think there is sort of a delicate balance between emphasizing again and again that yes, suicide is haram. There are implications. There are hadith that mention that there are sort of detriments and consequences to suicide, and at the same time mentioning this idea of, you know, compassion and awareness and peace within the family, to at least help family members cope with that as well, and to minimize contagion within the family members after the fact. So it's an ongoing conversation, and one that I think makes us gives us all a sense of responsibility to not sort of misspeak or not sort of speak too quickly about this issue.
I see a question coming about the toolkit. Osama, would you be able to address that?
I'm sorry, what was the question?
I can share it. So the question is, are there any are there any handling of overdose toolkits being developed by the lab currently? And there's a follow-up question, which is similar to that. You mentioned that there's some tools that imams can use for these kind of topics. Can you please refer to some of them?
So as far as the overdose, so we are actually in the lab just starting a addiction line of research with a similar mindset of let's create a manual and toolkit and training. But that one is very much still in its infancy. We're still doing a literature review, trying to consolidate best practices and how to integrate that with Islamically informed or grounded principles. We've obviously interviewed Sheikh Hassam in the lab to get his insight and takes on that. So, but that is still, I think, a little whiles out. As far as the good resources that we can refer, we haven't pushed out anything. We're still waiting on a series of focus groups to really vet the material. So we're going to bring in suicide experts. We're going to bring in a focus group of imams and community leaders to really make sure that the material that we've put together so far is scientifically accurate, Islamically grounded, and vetted from multiple angles and perspectives. And we want to make sure it's pretty thorough before we push out any drafts on the internet publicly available. But we have been working kind of with the communities on a as needed basis. Obviously, when suicides happen in the community or when there's suicidal crises, so if that is the case in your community, we're happy to share resources freely and openly and on a case-by-case basis, inshallah.
Did anyone want to talk and speak more about the resources? I think that was for you, Hassam. Question specifically directed to you. You mentioned that there are some tools that imams can use for these kind of topics. Can you please refer to some of them?
So again, we're working on a suicide toolkit at the Muslim Mental Health Lab, inshallah, and hopefully I'm really excited for that one to be made publicly available. But in the meantime, if you do get in touch with me, we worked on basically lectures, small lectures, reminders, khutab, small recording basically that one can use to send this message clear from an Islamic point of view. So we have some of that, and we also have small brochures that we worked on at ISNA to basically discuss the topic as well. So inshallah, I can share that with you. I'll leave my email here if any of you would like to reach out, inshallah.
Sheikh Hassam recorded the khutbah as an example in the aftermath of a suicide, and it's actually a really well done, phenomenal khutbah. So yeah, and that obviously speaks to the kind of resources and attachments we're including in the toolkit as well.
We have a question for the group with the case studies, the 2 case studies. But before that, I would like to take just a tiny minute here and acknowledge the person who asked that last question, Catherine. I had to sit with a moment to just appreciate the fact that you identify yourself as a non-Muslim provider, and yet you're here learning about a culture that is so relevant to the patients that you do. And I take a moment to commend you on doing that. And if more providers learn to do that, we would have more culturally competent providers, which the Lord only knows this country needs. My question for the follow-up question for the group that did the 2 case studies was there a particular reason why you picked those 2 case studies? I'm sure you had a large sample you could pick from.
Kamal, do you want to take this one?
I can give it a shot, and you can kind of supplement anything you feel like I might miss.
Sounds good.
But as Osama mentioned in the earlier parts of the presentation, the lab had been contacted by a number of people and has been contacted by a number of people even since these incidents. And I think a few things about this particular community that made it feel like a good opportunity to conduct a case study was that there were, it was one area with 2 different communities in the same area, and each community had an incident happen in them, and they were separate cases. They did not feel, it appeared as if the incidents were unrelated, but at the same time that the way that the communities responded in the aftermath was pretty disparate. And we felt like there was a lot of good opportunity to analyze what played a role in creating those differences. For example, the fact that the first community was able to have a mental health awareness program that was widely attended, and the second community was not able to do that. And what were the impacts of the inability to host that programming, and what caused that? Those types of questions were already out there in the communications we had with our community liaison, and we feel like that was just a very good. It was demonstrative of issues that we feel like other communities might face as well. And on top of that, we just had very good communication with that community. They're very active, really amazing volunteers that are there that did a super great job coordinating with us. The ability to have interviews with the families was huge, and we weren't sure if we were going to be able to do that when we headed into the case study. But the liaison was great, and she had a really great relationship with the families and was able to coordinate that for us. So those are a few of the reasons that I can think of.
Thank you. And can I use this moment to bring Dr. Shebak back in the conversation? There were themes of shame discussed in suicide in both presentations. And I know, Dr. Shebak, you always talk about honor and shame versus honor and shame driven culture versus a guilt driven culture. Would you want to contextualize that in a cultural context?
Of course. So there's several different cultural frameworks throughout the world. 2 of the ones that are most relevant, I think, to us are the dignity and guilt-based culture, where your moral and behavioral compass is inside of you. So you act, that's where you hear the things, just do what you want, be you, do you, don't worry about what people think, don't worry about what people say. These are the type of cultures that generally exist in the West. Minus England. England is unique, actually. They're more of a honor and shame based culture. Your honor and shame cultures are where the compass is external to you. So it's how are people perceiving you, and that guides your actions and your behavior. And that tends to be your North Africa, Middle East, sub-Indian continent, and some of the more Eastern nations and cultures, traditionally. Of course, things are shifting and changing all the time, especially with the smaller and smaller world that we live in. But these are 2 major cultural frameworks that are very relevant to the Muslim community in the US, because we are faced with both. Your immigrant communities are still going to, or first and second generations are still going to be tied to that honor and shame framework of culture, where the external does matter, what people think does matter, and what people say does matter, and your elders matter, and all these types of things matter to you. That is not bad. I don't like to say one culture is bad and one culture is good. There are different cultures that arise in different scenarios, different geographies, different socioeconomic pressures, different faiths and things like that, brought about these 2 wonderful schools of culture. And in the West, it's dignity and guilt. So what happens to immigrant communities is, as we integrate into a new culture, we start to adapt to the new cultural framework slowly. And that creates a lot of tension because sometimes that slow integration, there's certain phases, and while we're integrating, things collapse pretty quickly. So let's say, I always use this allegory of a tent. Let's say you live in the Sahara Desert and you have a tent. The tent is designed, it's not designed to keep out water, it's designed to keep out the sun. Now you take that tent and you throw it in the Amazon, it's not going to work as well. But do we want to destroy the tent completely when we go to the Amazon? Because it's still providing some shelter. It's just not the ideal shelter in that area. So no, you want to fortify it, you want to fix it, and you want to learn how to make a proper one. What we don't want to do is we don't want to shock our first generation, our parents, our uncles, etc., with destroying all of their protective factors that they've developed in the old world culture, and tell them that's all just backwards and nonsense, and you need to just adapt to this new way of being more open and discussing things openly and all that. You want to do it, you want to be respectful of that cultural framework if you really want to seek to change a perception on a given issue, because what works there does not necessarily work here, what works here does not work there. And so we have to be very empathetic and very careful in how we discuss it with people who may be new to all this, rather than shock them. Find the best way to communicate with them at the level that they're on, at the culture that they're on. And that takes a lot of cultural competency. It takes a lot of patience, and it takes a lot of hard work on our behalf. For example, I'm one of those people who's stuck in between two things. My parents were all born in the Middle East. I grew up with my grandparents, and my grandma always told me something along the lines of eat according to what you want to eat, but dress according to what people want you to wear. And it's a piece of wisdom. This is not, we don't laugh at her. We don't say that's the silliest thing I've ever heard. It's a piece of wisdom that stuck with me, but it tells you from which framework she's coming from. And so I'm one of those people that's a first generation. I was born here, but my family was all born in the Middle East. So I'm in that acculturation phase, integrating, trying to learn how to navigate this. And there's a lot of people that are in the same boat. And then my kids are going to be even different than that. So we have to anticipate, understand how cultural change happens, and not to label one culture as backwards and one culture as forwards. Rather, these are two respectful schools of culture that we have to understand how to link them and appropriately manage our patients, our communities, and understand why there's so much tension in between different generations and different ways of thinking. That's in a nutshell. I could go on and on, but I think that's in a nutshell kind of a summary of these two different cultural frameworks that we often deal with as Muslims, because there's other ones. There's like the face-saving cultures and the more fear-driven cultures, but those are the two big ones that we deal with as Muslims, as we integrate into both cultures.
Thank you for sharing that. We have a couple more questions, and we're coming to the end of time, but we have a little break, so I'll take the liberty of sharing these questions because I want to make sure that the people get these answered. They're pretty interesting. The first one says, thank you for discussing such an important topic. Do you think that conversations of Islamic ethical and spiritual protective factors can extend to other forms of self-harming behaviors? For example, non-suicidal self-injury.
Yeah, I think I can jump on that. When we think about suicide, it's important to understand that contemporary theories of suicide don't view suicide as like an isolated instance that just emerges out of nowhere. The idea is that suicide typically starts with ideation. So you start with thinking about thoughts of hurting yourself, and then it progresses into actions or plans, behaviors. So, maybe starting with self-injury, and accumulating those self-injuries eventually leads to suicide for most people. So when we think of it that way, I think it's really important to recognize there's sort of been like a shift in the suicide literature. The understanding was for the past 200 years, we've been studying suicide, and we've been focusing on a risk-based model where we're trying to understand, what is it that will lead to suicide? How can we predict suicide? And that has not served us very well. Like, sure, we've been able to understand some of the risk factors, but we actually aren't very much better off in terms of predicting who will actually go on to take their lives. So that's actually led in the recent years to like a shift into protective factors. There's this understanding that, suicidal ideation or suicide ideation is very, very common, but not everyone goes on to harm themselves. Not everyone goes on to kill themselves. So what is it that's stopping these people, the majority of people, from actually progressing in their suicide risk? And part of the understanding is we should look at those protective factors and see if we can translate them into people who are at risk for suicide. And so for a lot of people, the Islamic ethical and spiritual factors are very protective. And then there's other factors that are not sort of necessarily spiritual or ethical, but they're sort of within the Islamic context, like family connectedness and things of that nature, that are also protective. And so just having those conversations can actually expand or can attract people towards a more protective, I think, lifestyle of living, and also help. There's a theory in sociology called the moral community theory, which says that basically having more moral guidelines in one community, whether or not people actually subscribe to those moral guidelines, actually is protective to the community as a whole. So if you have more, let's say, for example, Muslim people in the community who are practicing and have a very strict opinion on suicide being unethical and not acting on it, then the people who have who are less practicing will also sort of subscribe to that understanding of suicide, just sort of almost by osmosis. I hope that answers the question. And I think Sheikh Hussam can answer the second question here.
The second question is, would love to know whether you would consider the mental status of a severely depressed individual as altered, similarly to altered mental status of a psychotic or a manic patient who are not held accountable for their actions.
Belal, do you want to take the first part and then I can answer the Islamic component to that question?
Yeah, sure, I can do that. So actually, we've got a chapter that's going to come out soon, and in Dr. Hamada and Dr. Rania's book on suicide in Islam. And one of the understandings here is that anyone who is sort of like not in an accurate mental state is, and Sheikh Hussam, you can correct me if I'm wrong, they're basically forgiven for suicide, so they're not held accountable for their actions. When it comes to someone who's severely depressed, the argument is that you can include them actually in that state because their mode of thinking is actually skewed. So for example, in the case that I gave earlier with the person thinking, I'm going to hell anyways, might as well quicken the pace, you would see that as actually a skewed process of thinking. So they're actually not thinking consistently with sort of Islamic practices. They're not thinking consistently in a healthy way. And so I think the idea that the ethical, the ethics writers in our chapter mentioned is it's almost beneficial to view these people as they have sort of lost sort of their mental status and approach them with forgiveness and approach them with compassion, because ultimately we don't know what a person's state is. We don't know whether they will be punished or forgiven by Allah. And so it's better to err on the side of caution rather than condemn someone to hell and harm the family and the other people in the process.
Yeah, excellent. So just to add very quickly, maybe 2 points to answer Sister Noor Effendi's question. Yes, the ethics that we discussed that apply to suicide will also apply to self-harm in a short nutshell. And in terms of the accountability of someone who's experiencing depression, as long as it's clinical from an Islamic point of view, they would be considered by the will of Allah subhanahu wa ta'ala to be exempt from the requirements. But the problem with that is a lot of legal scholars, they say that it's a downward spiral where people can basically claim for any reason I'm suffering from depression, and they would basically make a legal case in front of the court to justify all kinds of actions. So that's why the scholars of Islam, or generally in Islamic law, there is a difference between legal cases in court, like legal cases in front of a human judge, and then legal cases in front of Allah subhanahu wa ta'ala. So in front of Allah, there's a tendency to go towards forgiveness. Allah subhanahu wa ta'ala is the one who can forgive them. We open the door of compassion. But in legal cases, in human courts, in the Sharia court, you'd have to really prove that the person is clinically experienced in those states before they would basically be considered exempt.
Thank you so much. That's all the time we have. Would like to take a moment and thank all our sponsors for the event. Just have a special thanks to all our panelists and discussants and all the attendees. At the end of the session, I feel enriched. I feel that we've explored a very difficult topic in a very nuanced manner. And it's interesting that we came to talk to a panel about suicide, but I'm leaving with hope. And I hope that's the case with everyone else who was on the panel as well. Thank you very much. Attendees, please don't go away. Join us again for our next panel on interpersonal violence, which is also going to be very interesting. Thank you all. Have a great rest of your day. Assalamu alaikum.